Okay. How you guys doing?
Hey everybody.
This is Dr. Pinkney.
What's going on?
And I'm Devin, and I'm going to be asking her a few questions about being a doctor for St. Luke's and working in emergency medicine. And my first question is how is it working at two different emergency centers, at Pearland and Sugarland?
Well, I really like it. Number one, I think it gives a nice variety. So when I work here at the hospital, it tends to be more critical patients, which is more exciting and a little faster pace. And when I work in Pearland, it tends to be a little bit less, a little bit of a lower acuity, which is a nice break, and also a nice change in pace. So it
You
provides
get the
a lot
best
of
of
balance.
both worlds?
Correct.
Yes, awesome, I feel you. What is the most boring part about your job?
Most boring part of my job, I would say, is doing paperwork and charting.
Charting. Is that when you come back to the computer and put in all that information?
Typing and
Okay.
typing. And
She's a typing whiz. Her fingers go like this. Yeah, I see you do that often, and all the codes and stuff you have to put in there.
Correct, yes.
Seems kind of boring.
It is.
What is the main reason you decided to become a doctor?
Because I love people, and I love trying to help people, and I love trying to make a difference in any little way I can.
Making a difference. I understand that. That's my motivation to become a doctor too.
That's right.
You see this dynamic duo?
Dynamic duo.
Describe the most difficult part of your job.
I think the most difficult part of my job is if I don't know the answer to what's wrong with someone, or there's something that I cannot fix, or help guide in the right direction to get that fixed, or if a child or someone who's young or unexpectedly passes away. I think those things are very challenging.
So, unanswered questions in death, really? Those are the hard things to work with? Yeah, I imagine those are the hardest parts. My final question is, what is something about triaging children you think people should know?
Triaging children is often more difficult because they can't communicate as explicitly or concretely as adults. And so you have to utilize a lot of context clues, a lot of behavioral cues, and a lot of historical information to help sort out how sick the child is.
Okay, awesome. I love how you broke that down, behavioral cues and everything. Well, that's all I have for you. It appears a nurse needs Dr. Pinkney right behind you.
No problem. It was a pleasure. It was a pleasure. Yes. What's up?